it's Alex here from Aleks Physio. So today we're going to be going over 5 exercises that you can do after a neck surgery. For those of you who don't know, my name is Alexander Kravich. I'm an advanced practice physiotherapist at the Spine Clinic in Vancouver, British Columbia, and I'm going to be chatting about 5 exercises that you can do after you've had a neck surgery, which can include an ACDF, PCDF fusion surgery, a laminectomy, discectomy, or a combination of each of those. So the premise behind these exercises is we're trying to improve our mobility or range of motion. We're trying to improve or maintain our strength in our neck and our surrounding muscle region, in addition to try to decrease some of the pain, decrease some of the stiffness, and improve our recovery post-surgery. So the first exercise we're going to do is just some shoulder shrugs. So I just want you to have your hands at your side, and you're just going to try to bring your shoulders to your ears. So nice and low level exercise, shoulders to ears. Shrug it up and down. You just go as high as you feel comfortable with doing it, and then relax. So straight up and down. The next exercise we're going to do are some shoulder circles. So now instead of going up and down, we're going to try to make some circles. We're going to go forward and down. We can go one direction, then we can reverse it going backwards. So again, there are a bunch of muscles that are attached from our shoulder region to our neck, so it's important that we maintain some of the mobility in those muscles there. Okay, that's exercise 2, so shoulder circles. Exercise 3, we're going to work on some isometric. So our neck can do 4 movements. We can bend, extend, side bend, and rotate. So these isometrics are meant to maintain some of that strength and build up some of the strength around the neck region muscles. Okay? So the third exercise we're going to do in the first isometric we're going to do is neck flexion. So you're going to take your hand, you can make a fist or open palm, and you're just going to try to think about pushing into your hand. So your head is trying to bend down, but your hand is trying to push your neck back. So you're just meeting that resistance and holding. You should feel the muscles at the front of your neck activate in this position. And the nice thing about these isometrics is that you can add as much tension or as little tension based on how your pain is. So that's exercise 3, isometric neck flexion. Exercise 4, we're going to do isometric neck extension. So now you're going to put your hand behind your head, and then you're going to try to push back into your hand. So again, your hand is pushing forward as if you're trying to flex your neck, but then your head is trying to go back. So you're meeting that resistance. There should be no movement of your neck when you do this, because you're just meeting the resistance from the counter pressure that the hand is applying. You should feel the muscles at the back of the neck turn on for this one. The last exercise, or the 5th exercise we're going to do, are just some chin tucks. So we're trying to think about making a double chin. So you're going to poke your chin forward, and then you're going to try to tuck that chin down and back. So it's almost like if the drawer is open when your chin is forward and your head is forward, you're trying to close the drawer. So you're making a double chin, but you're also nodding down slightly. Okay, so the hand or the finger on the chin helps with just some of that cueing to get you to think about the direction that you're going. So it's like a back and down motion. So you're trying to do both of them at the same time. Again, that's going to strengthen some of those deep and superficial neck flexor muscles that are located around the front of your neck region. So for these exercises, try to aim for 5 to 10 repetitions for 2 to 3 sets, and try to do it 1 to 2 times a day, or as directed by your surgeon. I know at the hospital that I worked at previously, we would give our patients a pamphlet or a booklet that had a bunch of these exercises done. Some surgeons may require you to wear a collar, so that's another thing to be mindful of. As always, this isn't medical advice, just follow your surgeon's advice or what their specific recommendation and their protocols are. But these are some general exercises that are important that you can work on after your surgery. So there you go. We went over 5 exercises that work on strengthening the neck and improving the range of motion in the neck and the surrounding shoulder region area. Well, we went over the shoulder shrugs, we went over the shoulder circles, we went over the isometric neck flexion, isometric neck extension, and then we also went over the chin tucks. So obviously there's more exercise, and these aren't the top 5 or the main 5. It's just some things, some ideas and exercises to get you going to hopefully help to decrease some of your pain, decrease some of your stiffness, and improve your overall recovery. Let me know what you thought about this video down below. Have you had a recent neck surgery, or are you planning to have an upcoming neck surgery? Let me know below how your process has been, how you've been dealing with it, and how your recovery has been. These exercises can also be used as a prehab tool, so they can be used before your neck surgery to improve or to help improve your recovery afterwards and prep those muscles and your body for what's to come. If you find value in this video, consider checking out some of my other videos that I have on my channel. I have over 400 videos on various topics, physio and medicine and exercise related. If you still find value in my content and what I'm putting out, consider subscribing to my channel. It really allows my channel to grow. Until then, we'll see you in the next video. Thanks for watching.